Hello, and welcome to the Lagom ODP Job-Related Knowledge and Skills Training. As a result of the regulations for ODP, this training is a requirement for all direct support staff who work for Lagom and also work specifically under the ODP waiver to take this training annually. This is one of the few trainings you will have to take annually. This training specifically is provided to you by Lagom through your Paychecks account, along with the other trainings that you will complete through the myodp.org website. We hope this training helps all direct support staff learn the importance of their role as well as provide knowledge of their job. Let's begin. Throughout this training, I will guide you into different sections of the job-related knowledge training and explain each category with definitions and examples. The following sections we will go over are orientation, annual training, DSS job description, ODP services, ODP 4060 rule, Access Care mobile app, ODP rounding rule, bed to wheelchair transfer, standard precautions, definition of light housekeeping, safe eating and feed procedures, individuals with IDD effective communication, and we will finish this training with ODP resources for those who are interested in receiving information directly from the ODP website. We will begin the first section of the training discussing orientation and annual training. The Office of Developmental Program, also known as ODP, require that all active direct support staff complete 24 hours of training related to job skills and knowledge annually. For the orientation portion, this training applies to direct service professionals, full-time and part-time, who will work alone with an individual. The orientation must be completed after hire and prior to working alone with an individual or starting to provide a service to an individual. There are 5 certificates that must be obtained through the MyODP website and turned into your corresponding care coordinator. These certificates are individual rights, person-centered practices, abuse, prevention, detection, and reporting of abuse, recognizing and reporting incidents, and job-related knowledge and skills. Lagom also offers training bonuses when direct support staff completes and turns in their certificates on time. For the annual training portion, these are 24 hours of ODP training that are split into 4 quarters throughout the year. These trainings are to be completed annually. The annual trainings will be sent by your care coordinator via email with a due date. Some trainings require to pass an exam in order to obtain a certificate. Lagom's Care goal is to support ODP's vision of everyday lives, values, and action, where with the support of staff, family, and friends, people with disabilities can live their definition of a happy life. Lagom has designed an ODP direct support staff annual training that meets the 6100 ODP regulations of 24 hours. These trainings will be split into the following 4 quarters and will be completed annually. The first quarter contains 6 credits that need to be completed by March 1st of every year. The second quarter contains 6 credits to be completed by June 1st. The third quarter contains 6 credits to be completed by September 1st, and the final fourth quarter contains 6 credits that need to be completed by December 1st. As always, please make sure to reach out to your care coordinator for any assistance needed to complete these trainings. We will now begin to discuss the DSS job description. A direct support staff, also known as DSS, is an ODP trained worker who is educated to provide non-medical personal care to assist with an individual's daily activities and related services within the home and/or community. Assignments can vary depending on the type of ODP service a DSS is working under. All DSS are responsible to report to their corresponding care coordinator. The DSS position is broken down into 5 categories: skills, documentation, communication, professional standards, and professional development. The first category are skills. These are tasks that a DSS should know how to do or tasks that a DSS will need to do depending on the individual's needs. Some tasks may include helping the individuals with non-medical personal care, which includes but is not limited to bathing, nail and skin care, oral hygiene, shampooing, grooming, and shaving. It's important to note that a DSS should not cut toenails as this can cause an infection and should only be handled by a professional. A DSS might also need to prepare nutritious meals or snacks for the individual as assigned, assist with activities of daily living such as grocery shopping, provide basic emotional support to the individual and other members of the household, including dealing with difficult behaviors, help to maintain a clean, safe, and healthy environment for the individual by assisting with general household activities and chores such as light housekeeping tasks, handle emergencies and seek guidance appropriately, recognize changes in the individual that need to be addressed, cue to prompt the individual to perform self-care tasks such as to take self-administered medication. Please note that a DSS should not administer medication. Please assist the individual by simply giving them medication reminders. A DSS may assist individuals with non-medical health maintenance activities and routine wellness services, such as enabling adequate nutrition, exercise, keeping of medical appointments, and all other health regimens related to healthy living activities. A DSS should also escort and transport individuals to medical appointments when assigned, provide companion and respite services to assist a functionally impaired individual who cannot be safely left alone, and recognize and report significant occurrences such as abuse or neglect and critical incidents. The second category is documentation. A DSS should accurately read and follow the individual's care plan, accurately complete progress notes after each shift, and turn in on time to their corresponding care coordinator. Please note that progress notes are only applicable for in-home community support services. A DSS should also accurately complete shifts using the Access Care mobile app and submit work availability to the office for scheduling. The third category is communication. A DSS should report any change in the individual's mental or physical condition or their home situation to their corresponding care coordinator. They should also maintain privacy of an individual's information, adhering to the HIPAA regulations. A DSS should adhere to the attendance policy rule and maintain communication with care coordinator regarding their schedule, emergencies, call-outs, and clock in and outs. The fourth category is professional standards. A DSS should only perform the assigned activities as developed by the supervisor for the individual, bringing any additional individual needs to her or his attention. Comply with infection prevention and control and safety procedures. Adhere to all policies and practices of the agency to maintain established practice standards. Carry out only those activities for which he or she has been trained and supervised, bringing to the supervisor's attention any assignments that she or he does not feel competent to perform. Maintain a professional standard of conduct, projecting a positive image of the agency at all times. Work with individuals in a caring, therapeutic, culturally sensitive, and professional manner, and respect individuals' rights and the independent living philosophy. The final category is professional development. A DSS will complete all ODP training requirements through the myodp.org website and Lagom Care's annual trainings through their Paychex account. A DSS will participate in an annual performance evaluation and competencies and will also participate in staff meetings, care conferences, educational sessions, and the quality improvement program as appropriate. We will now begin to discuss the ODP services. Lagom Care offers 4 different kinds of ODP services. The following services are in-home community supports, companion, respite 15 and 24, and homemaker chore. The first service we will discuss is the in-home and community support service. This service is to assist individuals in gaining, maintaining, and/or improving their independence, social, and adaptive skills necessary to successfully flourish in home and community-based settings based on their goals. The services consist of support in the general areas of self-care, communication, fine and gross motor skills, mobility, personal adjustment, relationship development, socialization, and use of community resources. Family members can provide this kind of service and also requires progress notes. This service falls under the Consolidated PFDS, Community Living Waiver, and BASE. An example is Jane Doe is a person with mild intellectual disabilities who would like to learn how to pay for her own things. Each week, her direct support staff takes her to the bookstore to pick out a book of her choice and allow her to pay the cashier the money she owes and count and save the change she receives. This allows Jane Doe to learn how to perform a proper money transaction. As mentioned before, progress notes are a requirement for the in-home and community support service. As of January 1st, 2024, Lagom Care will provide access to digital progress notes. Progress notes are now completed and submitted through the Access Care app under Forms. What is the purpose of them? They reflect the individual's outcome statements and goals. The purpose is to evaluate whether the activities occurring are helping the individual achieve their desired outcomes. What do they need to include? Digital progress notes must be completed for every shift worked under the in-home community support service and must include the following. The progress note must be written in English, must include the name of the individual, the name of the direct support staff, the date of service, 4 to 5 sentences minimum reflecting the outcomes, a completion of the level of support questionnaire, community outings if applicable, and signature of direct support staff. When are they due? Digital progress notes are due on every Monday on a weekly basis. Where can I find the progress note on the app? You can find the progress note using 4 steps. The first step is logging into your Access Care app and clicking on your current visit. Step 2, please click on Forms at the bottom. Step 3 is to click New Form, and once you click New Form, under Other, Step 4 is to click the individual's progress note. When you open the individual's progress note, you should see the main page where you will find the individual's outcomes and a few reminders. Please note that the instructions throughout completing the progress notes are available in both English and Spanish. As you scroll down, you will now enter the progress notes section. This form reflects for the current week, Sunday through Saturday, and fill in for only the days you worked with the individual. As a reminder, it needs 4 to 5 sentences of the activities and events that occurred throughout the day. In the photo above, you will see a proper progress note under December 3rd, 2023, and it states, "Today, Jane woke up in a happy mood. She wanted to buy new books, so we went to Barnes & Noble's. She picked out 2 animal books and purchased it by herself. We went out to McDonald's for lunch. Jane spent the rest of her days reading her new books." After completing the progress note section, you will scroll down and see the level of support questionnaire. This section includes 2 to 3 sentences on how you supported the individual throughout the week. As an example above, this week I helped Jane make her requested meals. I transported her to the bookstore so she could buy the book she wanted and kept her company when she needed me. After completing the level of support questionnaire, you should scroll down and see community outings. This is where you write any community outings if applicable. If no outings, simply write no outings. Using the example above, she wrote Barnes & Noble's and McDonald's. And finally, the final section is the acknowledgement and certification. This is where you sign your signature and then click Save. Please note, administrative review portion is strictly for the care coordinator. If for any reason the Access Care app is down and/or Lagom Care has to resort back to the paper progress note, this is the guidance to complete a proper paper progress note. It includes the same requirements such as the individual's name, the direct support staff name, the date of service, the outcomes listed in the individual's ISP, the progress note section, incident reporting section, level of support, location of community outings, and the direct support staff signature. Here is an example of a proper paper progress note completed. As you can see, the outcome listed in the individual's ISP is Jane to go out into the community to participate in activities of her choice and increase social skills. Jane is to also learn money management and transactions to increase financial independency. In the progress note section, this support staff wrote, Jane woke up in a positive mood. I supervised her make eggs and bacon for breakfast. She cleaned up her own dishes and reminded to take her daily meds. We got ready to head out to Barnes& and Noble's because Jane wanted to buy a new book to read. When we arrived, Jane went to the kids section and picked out a book about animals in the jungle. Jane enjoys reading about animals and their environment. We went to the checkout line and Jane paid for her own books using cash. I helped her count the change and showed her where to store it in her wallet. We went back home and Jane spent the rest of the afternoon reading her book while I prepared lunch. Jane had a great day. As you can see, there are no incident reporting. The staff had completed the level of support area and put Barnes & Noble's Neshaminy Mall for the location of community outings and included their direct support staff signature and the date of service. This is how a proper progress note looks like when using paper. The second service that Lagom Care offers is companion services. This is a service provided to individuals who are of age 18 or over living in private homes for the purpose of providing supervision, assistance with their daily living tasks, and maintaining their health and safety. Companion services are used to protect the health and well-being of the individual when an outcome goal is not appropriate or attainable, when the individual is not learning, enhancing, or maintaining a skill. Family members can provide this kind of service, and it does not require progress notes. This service falls under the Consolidated PFDS Community Living Waiver and the BASE program. The next service that Lagom Care offers is respite. Respite is a service that is used as a temporary sense of relief for a primary or family direct support staff who needs a mental, emotional, or physical break from caring for an individual. Various tasks include meal preparation, medication reminders, light housekeeping, and companionship. Family members cannot provide this kind of service, and it also does not require progress notes. Please note there are two different kinds of respites. Respite 15 is provided to supervise and support individuals living in private homes on a short-term basis for planned or emergency situations, giving the person or persons normally providing care a period of relief that may be scheduled due to an emergency. There is a limit of 480 units per fiscal year in the consolidated waiver and 1,440 units per fiscal year, with a variance process to request additional units. Respite 24 has the same definition. The only difference is there is a limit of 30 units per fiscal year with a variance process to request additional units. The respite service falls under the Consolidated PFDS and Community Living Waiver. The final service is Homemaker Chore. This is a service to maintain an individual's comfort within their primary private home. This service consists of chores needed to maintain a clean, sanitary, and safe condition while the individual is not present for a period of time or cannot maintain their own space. Family members cannot provide this kind of service, and this service also does not require progress notes. This service can only be provided when a household member is temporarily absent or unable to manage the home, or when no landlord or provider agency staff is responsible to perform the homemaker activities. Homemaker services include cleaning and laundry, meal preparation, and other general household care. Homemaker chore falls under the Consolidated PFDS, Community Living Waiver, and BASE. An example of homemaker chore services are: Jane Doe is hospitalized for 2 weeks due to an illness. Her direct support staff will be providing homemaker chore by cleaning her home, getting groceries, laundry, and caring for her pets until Jane Doe's return. We will now begin to discuss the 40-60 family rule. What is the ODP 40-60 family rule? It's an ODP rule that allows a relative to provide in-home and community services and companion service for an individual. A single relative can work up to but cannot exceed 40 hours per week. Multiple relatives can provide services but cannot exceed a combination of 60 hours per week. What is considered a relative? A relative is considered any of the following: a spouse, parent, step-parent, grandparent, brother or sister, half-brother or half-sister, an aunt, uncle, niece, nephew, adult son or daughter, adult stepson or stepdaughter, and or an adult grandchild. Here is an example of an approved 40-60 scenario. John Smith, who is the individual, is authorized to receive 50 hours of companion services per week. His mother provides 30 hours per week, and his sister provides 20 hours per week. This is acceptable because neither relative is providing more than 40 hours of service per week individually, and together they do not provide more than 60 hours per week of services. Here is an example of an unapproved 40/60 scenario. Jane Doe, who is the individual, is authorized to receive 70 hours of in-home and community services per week and 20 hours of companion services per week. Her father provides 35 hours of in-home and community services per week, and Jane's nephew provides 20 hours of companion service per week and 20 hours of home and community rehabilitation. The remaining hours of in-home and community services are provided by a direct support staff who is not a relative. The total number of hours of service provided by relatives is 75 hours per week. This is not acceptable because Jane's relatives are providing over 60 hours per week. Jane's father or the provider agency must find a new direct support staff who is not a relative to provide the remaining hours. We will now begin to discuss the Access Care mobile app. Lagom Care uses the Access Care mobile app in order to obtain the electronic visit verification, also known as EVV. EVV is a requirement in the state of Pennsylvania which requires all shifts to be verified electronically. For a successful shift, direct support staff will need to do the following. Clock in. Please note that all staff have a 5-minute window prior to start of shift to clock in, or they can clock in right on time. They should also always enter the ADLs. Please note that if working for a companion case or shift, you must click the individual's ODP companion outcome statement after every shift. Direct support staff should also make sure they enter the client's signature, their own caregiver signature, and make sure that they clock out on time as well. Please note that all staff have a 30-minute window to clock out. If a worker is not able to clock in and or out, they must contact their corresponding Lagom Care coordinator for further assistance. Now that we've discussed the Access Care mobile app, we can now begin to discuss the ODP rounding rule, which plays a great factor into clocking in and out on time. When working for an ODP individual, a direct support staff must work every second of every hour approved for the shift for Lagom Care to bill correctly. If an ODP direct support staff does not complete the full amount of time the individual was supposed to receive during a shift, Lagom Care cannot bill for the units from the beginning of a shift and at times a combination of both. As you can see in the examples below, direct support staff Jane Doe has a shift from 9 a.m. to 3 p.m. In the first slide, we can see that she clocked in at 9:01 a.m. and she clocked out at 2:55 p.m. The shift hours are 8, but she only worked 7 hours and 54 minutes. This means that Lagom Care cannot fully bill for the shift in total. An example of a fully billable shift is direct support staff John Doe worked a shift of 9 a.m. to 3 p.m. He clocked in at 8:56 a.m. and he clocked out at 2:59 p.m. This shows that he completed a bit more of his 8-hour shift, which means that Lagom Care can fully bill for the shift. The ODP rounding rule works a little different for overnight shifts. This is because Access Care will automatically clock the staff out at midnight. Why does this matter? Because within the Access Care system, midnight is considered a new day. If you clocked in late, even by 1 second, we automatically lose the first 15 minutes because you cannot make up for it on the back end. This also means that since the system automatically clocked staff out at midnight to end the previous day, it will automatically clock staff back in at midnight to begin the new day. So you must complete the shift until the indicated shift ends. Remember that you cannot take into consideration what minutes you clocked in early the night before. We have now completed the first part of the training, which went over the requirement for the trainings, your job description, the types of ODP services Lagom Care offers, some ODP rules, and how the Access Care app works. We can now discuss specific definitions and methods on how to effectively work and care for an individual with intellectual disabilities depending on their needs. Let's begin with bed-to-wheelchair transfer for individuals who use a wheelchair on a day-to-day basis. Some individuals can benefit from using a wheelchair because their ability to walk is limited or inefficient. The needs of each wheelchair user will vary. However, they all need an appropriate wheelchair, and some may need assistance with transferring if they cannot support their own body weight. It takes strength and coordination to be able to move in and out of a wheelchair from a bed, toilet, chair, etc. Here are some steps to help a direct support staff prepare for the task of transferring from the bed to the wheelchair, and also to learn how to position themselves to avoid injury. We can secure an easy transfer using 5 steps. Step 1 is to secure the wheelchair. Position and lock the wheelchair near the bed, and remove the armrest nearest to the bed and remove the footrest from the chair. Please note that removing footrest can prevent tripping hazards. Step 2 is to help the individual sit up and face the chair. Put your arm under the individual with your hand supporting the area between their shoulder blades. Put your other hand under the knees. Swing the individual's legs over the edge of the bed, helping the individual to sit up. Step 3 is to stand the individual up. Have the individual seated near the edge of the bed. If the individual can sit unassisted, now is a good time to put on skid-proof socks or shoes or apply a gait belt. Put your arms around the individual's chest and clasp your hands behind their back, or you may also want to use a gait belt to provide a firm handhold. Supporting the leg farthest from the wheelchair between your legs, lean back, shift your weight, and lift. If the individual can assist, be sure to agree on the transfer plan and count to ensure individual assists as much as possible with the lift. Step 4 is to pivot toward the wheelchair. Have the individual pivot toward the chair as you continue to clasp your hands around the individual. If you have a helper, they can support the wheelchair or individual from behind. The final step is to sit the individual down. As the individual bends towards you, bend your knees and lower the individual into the back of the wheelchair. A helper may position the individual's backside and support the wheelchair. Reposition the footrest and the individual's feet. Reattach the armrest on the wheelchair. Apply safety restraints if applicable and unlock the wheelchair. You have now successfully transferred the individual from bed to a wheelchair. Let's discuss standard precautions, what it means, and how we can practice it on a daily basis. Standard precautions are safety precautions used to prevent the spread of bacteria, body fluids, and viruses. Standard precautions are used for all patient care, and they're based on a risk assessment and make use of common sense practices. These practices are designed to protect the direct support staff and to prevent the direct support staff from spreading infections among individuals. This portion of the training will cover hand hygiene, respiratory hygiene and cough etiquette, use of personal protective equipment, also known as PPE, and disinfecting contaminated equipment or surfaces in the individual's environment. We will first discuss hand hygiene. Hand washing is the single most effective means of preventing the transfer of infection. One should always practice the habit of washing your hands beginning and end of the workday, before and after using gloves, before and after handling food, before and after eating, before handling medications, after using the toilet, after wiping the nose or touching the face, and/or after touching contaminated surfaces. Hands can be cleaned with a hand sanitizer if there is no immediate soap and water available unless the hands are visibly soiled. Here are 5 basic steps to hand washing. Wet hands with water, then add an antibacterial soap. Use friction to generate lather and wash hands for at least 20 minutes. Rinse well under a stream of water. Dry hands thoroughly and turn off the faucet with paper towel. After hand hygiene, we should always place practice for respiratory hygiene and cough etiquette. Disinfection prevention measures are designed to limit the spread of viruses spread by droplet or airborne routes. This strategy applies to anyone with signs of illness including cough, congestion, runny nose, or increased production of mucus. Here are some instructions to direct support staff or individuals with symptoms of respiratory infection. Make sure to cover your mouth or nose when coughing or sneezing. Use and dispose of tissues. Perform hand hygiene after hands have been in contact with bacteria. Provide tissues and area for disposal of tissues. Encourage others to perform hand hygiene. Wear a mask and offer to coughing individuals and other symptomatic people when they enter the settings. And provide space and encourage individuals with symptoms of cold/flu to sit as far away from others as possible. Make wearing a mask a normal part of being around other people when appropriate. The appropriate use, storage, and cleaning or disposal of masks are essential to make them as effective as possible. To better support hand hygiene and respiratory hygiene and cough etiquette, it's very important to make a habit of using the personal protective equipment, also known as PPE. This is a special equipment you wear to create a barrier between you and germs. This barrier reduces the chance of touching, being exposed to, and spreading germs. All workers should use personal protective equipment when there will be contact with blood or other bodily fluids, as well as when exposed to airborne diseases such as COVID-19. Lagom Care provides personal protective equipment for all individuals and direct support staff workers. They can be picked up from the office, or your corresponding care coordinator can deliver a PPE bag during a home visit. Lagom's PPE bag include the following: mask, gloves in sizes small, medium, and large, and hand sanitizer. Please note that after you use a personal protective equipment, it's important to remove and dispose of the equipment safely to protect others from being exposed to germs. Make sure that before leaving your work area, you remove all equipment and put it in the right place. We will now discuss cleaning, disinfecting, and sanitizing. Some people think that disinfecting is the same thing as cleaning or sanitizing, but they are actually different. Cleaning removes dirt, dust, crumbs, and germs from surfaces or objects. When you clean, you will likely use soap or detergent and water to physically clean off the surfaces and objects. This may not necessarily kill the germs, but since you remove some of them, there are fewer germs that could spread infection to you. Disinfecting uses chemicals to kill germs or surfaces and objects. Some common disinfectants are bleach and alcohol solutions. You usually need to leave the disinfectant on the surfaces and objects for a certain period of time to kill the germs. Disinfecting does not necessarily clean dirty surfaces or remove germs. Sanitizing could be done by either cleaning, disinfecting, or both. Sanitizing means that you are lowering the number of germs to a safe level. What is considered a safe level depends on public health standards or requirements at a workplace. What you do to sanitize will vary depending on your needs. You might be mopping a floor using a mop, a chemical, and water. You might use a dishwasher to sanitize the dishes, or you could be using an antibacterial wipe on a TV remote. If you both clean and disinfect a surface or object, you can further lower the risk of spreading infection. There are products that clean and disinfect at the same time. Which surfaces and objects do I need to clean and disinfect? To prevent the spread of infection, you should regularly clean and disinfect surfaces and objects that are touched often. For example, in a household, this would include countertops, doorknobs, faucets, toilet handles, light switches, remotes, and toys. How can I safely clean and disinfect? It's important to be safe when using and disinfecting products. Store them in the containers they came in, and always follow the instructions and pay attention to the warnings on the label. Do not mix cleaners and disinfectants unless the label says that it is safe to do so. Combining certain products such as chlorine bleach and ammonia cleaners can cause serious injury or even death. Check the label to see whether you need to use gloves to protect your hands and/or eye protection when using the products. If you swallow, inhale, or get them on your skin, follow the directions on the labels or get medical help. And make sure to always store them out of the reach of children. As a direct support staff, one of your main duties as a worker is to maintain light housekeeping. We will discuss the definition of light housekeeping. A direct support staff can provide many different services in the home, such as assistance with bathing and meal preparation. But it is the task of light housekeeping that often requires additional clarification. What is considered light housekeeping? Light housekeeping should be thought of as a task that a direct support staff does to help provide better care to an individual. For example, when a DSS provides meal preparation, the individual can count on the DSS to clean up the kitchen, clear the table, put the dishes in the dishwasher, or wash by hand, and then place back in the cupboard. When an individual needs standby or hands-on assistance with bathing, the individual can rest assured that a clean towel and clean clothes will be ready for them, that dirty laundry will be placed in a hamper for washing, and that the bathroom sink, toilet, countertops, and mirrors will be cleaned and ready for the next use. Tasks include dusting open surfaces, sweeping and mopping floors, vacuuming around furniture, wiping down counters, washing and putting dishes away, cleaning bathrooms and kitchens, taking out the trash, changing sheets and making the bed, and organizing drawers, shelves, and closets. Light housekeeping is meant to be limited to the areas used by the individual, such as the bathroom, kitchen, bedroom, and living room. Light housekeeping tasks do not include deep cleaning tasks such as shampooing carpets, steam cleaning or scrubbing floors, cleaning glass windows, window sills and glass doors, cleaning ceiling fans, cleaning roofs and gutters, cleaning the exterior of a house or outside furniture, moving heavy furniture, and raking or mowing the grass. We will now begin to discuss safe eating and procedures. Some individuals with intellectual disabilities require 100% assistance when eating. It's important to practice safe eating and to follow specific procedures depending on their needs. Children and adults with intellectual and/or developmental disabilities have a higher risk of choking compared to the general population. Other things can cause eating or swallowing problems such as medications, behavioral issues, aging, illness, and/or surgery. How do I know if someone is having trouble eating or swallowing? You can know by noting if they're eating too fast or too slow, if they are pocketing food in their cheeks, difficulty breathing during or immediately after a meal or snack, if they are choking and turning blue, if you hear wet gurgle throat sounds, frequent throat clearing, and wheezing or constant coughing. What can I do to help an individual with an eating and/or swallowing problem? You can ensure this by doing two things. Number one is to make sure to properly prepare food. Prepare flavorful, colorful foods. Serve foods cold or hot as they should be. Don't mix foods of different sizes or textures together. And if someone takes a long time to eat, make sure to reheat the food. The second thing is to make sure to monitor the individual. Decrease distractions, turn off TV and limit conversations. Sit with the individual at eye level. Standing by them will make them lift their chin and open their airway and get food or liquid in their lungs. Make sure the individual is sitting upright before anything goes in their mouth, and never let an individual eat or drink lying down. Some individuals require special diet textures and liquid thickening to be able to swallow safely. These are called dysphagia diets. Some people have softer food textures for ease of chewing. These may be called mechanical soft or dental soft diets. Food should be soft, easy to chew, and cut in small bite-sized pieces. Some individuals must drink thicker liquids. The moral of the story is, if the individual has a special diet, make sure to strictly follow the plan. Here are a few positioning guidance to help an individual depending on where they are seated. If they are seated in a bed, make sure that the head of bed is fully elevated, their knees elevated slightly, their pillow is behind their head and their arms are supported. If they are seated in a chair, make sure they are seated in a straight-backed chair, that they have foot and arm support, and if their chair reclines, make sure to put a pillow behind their back to create an upright position. If you are caring for an individual who is wheelchair-bound, make sure you have them in the correct position for eating. Their shoulders are back, their elbows supported on chair or table surface, their food is within a 12-inch reach, they have a 90-degree flexion in their hips, knees, and ankles, a 45-degree neck flexion, and their feet are supported on the floor or footrest. Make sure to avoid the following to prevent an incorrect positioning for eating: rounded shoulders, head strained forward, unsupported elbows, posterior tilt at hips, sliding out of chair, and/or their table height is too high. What should I do if someone chokes or appears to have an eating and/or swallowing problem? If someone is choking, immediately implement life-saving procedures. Call 911 if breathing stops. Don't let the person wash it down with a drink, as this can force the material deeper into the airway or into the lungs. If breathing resumes, stop the meal. remove that food items from future meals. If someone appears to be coughing, stop the person from eating or drinking until coughing stops. Try eating or drinking again, but if the coughing continues, remove that item from the table and future meals. Remember, document the coughing or choking event. Be sure to include what you think may have caused the event and report the coughing or choking event to your corresponding coordinator. Now that you know more about safe eating and procedures, here are a few things to remember. Sometimes individuals with intellectual disabilities may eat or drink things that might look like food or beverages but are not. Be careful with containers or wrappers that might make things look like candy, soda pop, cans, or bottles. Look for things around the individual's house that might look like food. Some cooking supplies can be dangerous, so make sure to put away bottles of oil and vinegars. Some common things that people swallow can corrode and cause serious infection, such as coins, especially pennies, batteries, paper clips, and other small metal objects. Do not bring your cigarettes or alcohol into an individual's home, and never leave your medications where an individual might eat them. We will now begin our final topic of the job knowledge training, which is effective communication. Communicating with people with mild, moderate, or severe communication difficulties will differ. For those working in IDD care settings, communication barriers may arise. This is because the language and communication skills of each person with IDD are unique. Assessing the language skills of each person helps direct support professionals use an appropriate level of language. Whether you're in a professional setting or just having a personal conversation, it's very important to understand that all communication needs to be done in a compassionate, patient, and caring way. Here are 5 general tips to help you communicate with an IDD individual. Number 1. See the person, not the disability. People with intellectual disabilities are just like us and have the desire to build interpersonal relationships. They do not want to be defined by their abilities, but by who they are as a person. Remember that they all have their own individual identity, they feel the same emotions as we do, they will have personal interests and hobbies, they will experience romantic relationships, and they will have goals, dreams, and desires. You don't need to change your personal behavior when interacting with someone who has an intellectual disability. Avoid making assumptions about their communication style from the get-go and build a level of understanding first. Being empathetic, open-minded, and respectful throughout the entire conversation. Number 2, understand their communication style. Intellectual disabilities can vary, so it's important to understand the person you are speaking to first, and if necessary, adapt your own pace and communication style to match their vocabulary and level of understanding for more effective communication. Depending on the disability, you might need to implement an alternative communication style as needed rather than the spoken word. Some examples may include sign language, written, visual cues, and/or communication devices. People with IDD should not be treated like children just because they may have a different style of communicating. So avoid making assumptions before you start the conversation. You might need to use simplified language and speak slowly to help the person understand what message you are trying to send. Speaking louder is not necessary and could make the recipient feel uncomfortable. Using your normal pitch and tone as well as making eye contact as you would with anyone you are speaking to is vital. Number 3. Practice active listening. When communicating with an IDD individual, it's encouraged that you use active listening techniques to let them know that you are engaged in the conversation. Some things you can do to reassure them that they have your undivided attention include using open body language, looking at them directly, showing that you are listening through nonverbal cue reactions such as nodding, deferring any judgments you might have, allow enough time for the person to respond. Remain sensitive to the nonverbal cues and person's tone of voice. Muscle tone differences can complicate a direct support professional's ability to read an individual's body language or facial expressions. Inform the person when you do or do not understand something, and remember to never shout. Shouting is a trigger that can heighten the tension of communication among anyone. For certain individuals with IDD, this response can become heightened. Make sure to keep your communication calm and clear. Communication requires both people to be engaged in the conversation, so be patient and give the person the time to express themselves. Number 4, encourage clarification. Be prepared to repeat the same information more than once in different ways. Give exact instructions. For example, you will see the nurse at 10:30 rather than come back to see the nurse in 15 minutes. Avoid giving too many directions at one time, which may be confusing. Eliminate distractions and minimize background noise if possible. Avoid sensory overload by providing information gradually and clearly. Provide information in written or verbal form if that is the individual's preference. Recognize that the individual may need to have directions repeated and may take notes to help remember directions or the sequence of tasks. Before performing a task, explain what is being done and why. Demonstrate the action before performing the task. And finally, number 5, be inclusive during the conversation. People with intellectual disabilities also have a voice. They want to express their thoughts, feelings, and opinions whether through nonverbal or verbal communication. When interacting and communicating with a person who has an intellectual disability, it's important to promote inclusivity by setting their expectations, being patient during the conversation, asking for their opinion, being enthusiastic during the interaction, and not taking offense if their mannerisms differ from yours. Good communication requires both people to positively interact and understand the other regardless of their ability, and ensure that the environment allows for both people to feel comfortable and confident enough to express themselves. People living with intellectual disabilities will all have different ways of communicating and feeling comfortable expressing themselves. If you follow these 5 ways to encourage positive interactions, be part of the change and continue promoting inclusivity for all people regardless of their abilities. There are a few additional communication types. Here are some communication tips when interacting with an individual with vision loss. Identify yourself when you approach an individual who has low vision or blindness. Introduce anyone with you to the individual. If the individual uses glasses, ensure that they are readily available to the person and that he or she uses them. Touch the individual's arm lightly when you speak so that he or she knows you are speaking to them. Face the person and speak directly to him or her. Use a normal tone of voice and remember to avoid shouting. Explain when you are leaving the area. When you're helping an individual with vision loss, allow them to take your arm. When assisting the individual to a chair, place the individual's hand on the back or arm of the seat. And never pet or otherwise distract a canine's companion or service animal unless the owner has given you permission to do so. Here are some communication tips when interacting with an individual with hearing loss. Ask the individual who is hard of hearing, deaf, or deafblind how he or she prefers to communicate and eliminate or minimize background noise and distractions. If the individual uses an assistive hearing device, such as a hearing aid, ensure that it is readily available and in working order and that he or she uses it. If you are speaking through a sign language interpreter, pause occasionally to allow the interpreter time to translate completely and accurately. Talk directly to the individual who is assisted by a sign interpreter, not to the interpreter, even if the person is looking at the interpreter and does not make eye contact with you. Before you start to speak, get the attention of the individual you are addressing. Visual or tactile signals can be used to get their attention. Speak without exaggerating your words. Do not raise your voice unless you are specifically requested to do so. Speak in a normal voice without shouting. If the individual lip reads, face the individual and keep your hands and other objects away from your mouth. Maintain eye contact and do not turn away or walk around while talking. Consider that written English may not be the primary language for some people with disabilities and make appropriate accommodations in communicating with them. Ask the individual for feedback or to repeat what you have said to assess understanding. And if you do not understand something that is said, ask the individual to repeat it or to write it down. Do not pretend to understand if you don't. And finally, here are some communication tips to interact with individuals with speech difficulties and/or disabilities. Talk to individuals with speech disabilities as you would talk to anyone else. Use your regular tone of voice without shouting. Be patient because it may take the individual extra time to communicate. Do not speak for them or complete their sentences. Give the individual your undivided attention and eliminate background noise and distractions. If the individual uses a communication device such as a manual or electronic communication board, ask the individual the best way to use it. Do not pretend to understand if you do not. Tell the individual you do not understand what he or she has said and ask the person to repeat the message, spell it, tell it in a different way, or write it down. Use hand gestures and notes. Repeat what you understand and note the individual's reaction, which can indicate if you have understood correctly. Develop a specific communication strategy that is consistent with the person's abilities. Nod of the head or blink to indicate agreement or disagreement with what you have asked or said. To obtain information quickly, ask short questions that require brief answers or a head nod. Avoid insulting the individual's intelligence with oversimplification. And this concludes the end of the job knowledge training. Attached here are links to ODP resources to access information about the ODP waivers and services directly from the ODP website. Thank you for your participation, time, and attention. We hope you found this training to be informative and useful as you are now more educated on how to properly care and interact with individuals with intellectual disabilities based on their needs. Thank you for making a difference in this field, and we hope you have an amazing rest of your day.